Hi, my name's John Thomas. I'm a physical therapist at Laguna Orthopedic Rehabilitation, and today I wanted to talk about my philosophy on running shoes and orthotics. As a runner, when you're looking for a running shoe, you go into a running store and you go through their typical approach in terms of recommendation of a running shoe. You stand on a device that measures the width and the length of your foot to make sure you have the right size. And then many times you stand on a force plate that's looking at your arch type and the plantar surface. Based on these findings of arch type and plantar surfaces, the running shoe is recommended. For a more normal arch or a higher arch, many times the recommendations for a neutral running shoe will be prescribed. If you're more of a kind of a midfoot or heading towards a flatter type plantar surface, they recommend a stability type running shoe. And if you're really flat-footed and you have an excessive pronation, you may be recommended to put into a motion control running shoe. Now, does this approach really work? Well, the research studies that I've reviewed look at putting runners into these different categories to see, is there really a difference? There was one study that was performed in 2008 when they took 3,000 recruits in the Army that were going through training camp and followed the model of looking at their arch type and plantar surface. They cut them in half. So they had 1,500 in one group, 1,500 in another group. In that 1,500, they followed that typical analysis of standing on the force plate. Okay, you get a neutral, you get a motion control, you get a stability. And they went through that for all their 1,500 recruits. And the other 1,500, they just put in a stability shoe, no matter what type of arch or plantar surface they were seeing. After the training camp, what they found was that there was no significant difference in terms of injury reports. Okay? This study was then done by the Navy and the Marines, and they also found no significant differences in injuries. So what do? Well, comfort. Let comfort be your guide when picking a running shoe. Comfort is huge. If you've been prescribed a certain running shoe and you go out and run and it's not feeling comfortable and you're thinking, oh, maybe I need to break it in, it's probably not the right shoe. And running stores out there have 60 to 90 days return policies where you can go in and get a different running shoe and go and find a good one that's comfortable for you. If you're a heel striker, and many of us out there are, I think about 89% of the population are heel strikers. You might think you're not a heel striker, but I would definitely recommend you having a friend videotape your running mechanics on a treadmill to see what type of strike pattern you utilize. Heel strike, midfoot, forefoot. And there's specific shoes out there for your running style. Now for a heel striker, first of all, comfort. And then things to avoid when you're picking a running shoe is, this shoe has a little bit of it, but an excessive lateral flare. So you're heel striking, you're coming in, many of the heel strikers land a little bit on the heel and then the lateral side of the heel. So then if you have this excessive flare and you're landing lateral, that's going to really cause a higher ground reaction force that could potentially take you into a excessive pronation type moment, which could put stress on the plantar fascia, cause poor things to happen up the chain, affecting the knee, even the hip or the back. I would look for that excessive flare and then even an excessive posterior flare, because if you're heel striking and you have this jutting out and now you're having that longer lever arm that's going to force you into a rapid plantar flexion moment, that could definitely put stress in the front of the foot, which could cause shin splints and other issues to occur. You're a forefoot striker, many times you're landing mid to forefoot, which is great, landing softly, but with forefoot striking, many times as you're coming in, you're foot is a little bit inverted before you land. And so if you have a shoe that supports that type of running style, you want to make sure that it doesn't have an excessive midfoot flare. Because if you're coming in and landing on the midfoot, lateral, and you have this excessive flare, that again, like the example I used for the heel striker, that can influence a more abrupt moment, forcing you into more pronation, which can then cause issues at the foot or up the chain. So in closing, pick a comfortable running shoe. Try many types of running shoes. If you're a new runner and you're getting into running, you go through an analysis and it doesn't feel comfortable, don't feel like you have to go in and break it in. Try it. Keep trying the running shoes until you get the right fit for you. If you're having an injury, then I definitely recommend seeing a physical therapist that specializes in treating the injured runner, so they can do a thorough biomechanical evaluation and make their recommendations following that. Happy holidays!